Welcome to the Healthcare Executive Insight Podcast. My name is Elliot Sloan with the Macallan Group. And today we have a very special guest, Ben Unkle, the CEO of Westminster-Canterbury Senior Living Community. Ben, thank you so much for taking time to chat with us today. If you could, please tell us a little bit about yourself and your professional experience, and then we'll talk a little bit about Westminster-Canterbury Senior Living Community.
Yeah, well, don't hold it against me, but I'm a lawyer by training, spent 7 years practicing law with a big city law firm in Baltimore, Maryland. And one of our clients of our firm was Erickson Living, and joined John Erickson's company. It's a privately held company that's a big player in the senior living industry, and grew up in that company and moved around. And I've been the CEO at Westminster-Canterbury on Chesapeake Bay, which has since started a number of other companies and grown for the last 11 years here in beautiful Virginia Beach.
That's amazing. It sounds like you're a very busy guy.
Yeah, we've got a lot going on, and that's what keeps life fun and interesting. There's no shortage of demand or need for what we do. And so it's fun being in an industry where you're trying to say, how much more impact can we make prudently in the face of nearly unlimited demand?
Yeah, I mean, the reality is we're all aging and we're now living longer than ever.
Exactly. Longevity is higher. I remember, my grandparents, we all thought, and this isn't just young bodies looking at old bodies, but in terms of the reality of how long people lived, you thought, somebody in their mid 60s, upper 60s was, close to their reward. Now, lots of people are living into their 80s and 90s. And here at Westminster, I think we have over 10 people who are centenarians.
Wow.
And, you feed people well, you provide exercise, and you provide a great independent living experience. They're going to live longer if and when they ever need higher levels of care. You're just going to have them at older ages because they've had a good environment to have a healthy, strong body.
There's a lot of studies coming out that the mind, body, and soul have to be treated equally. And having a quality of life and having a calm mind and low anxiety and low stresses really makes a big impact on your body's ability to fight disease.
Yeah, I mean, study after study, you just Google factors of longevity, and you would find all kinds of academic research. They all say the same thing. Our bodies need to be used, our minds need to be used, and our spirits require purpose, no matter what age we are. And where you get purpose in life is being part of community.
Community. You took the word out of my mouth.
Yeah, that's true. I mean, you just think about it. You can't have a lot of purpose alone unless you're on, Zoom calls all day with a crisis hotline or something like that, unless you find a way to make yourself useful through Zoom.
Yeah.
Usually it involves interacting with other human beings to have purpose in life. And we were just wired that way, and we need that. We need significance.
Human interaction is the key to staying young.
Amen. Engagement is the key to staying young. I mean, even engagement with ideas, you have to have some degree of human interaction. And when you cut off that, even for the introverts, they're not happy, as we learned during the pandemic. However, they might be able to contribute by writing a book.
Sure.
And being engaged in that way. And the nice thing about living in community, in proximity with other peers, is that you can pick and choose the level of involvement. Nobody comes through with a shepherd's hook and grabs you and pulls you out to engage, but it's there. I heard a lady recently say her husband passed away. She moved. She's quite young. A lot of an increasing number of our residents come in their mid 60s. You have to be 62. And her husband had passed away, and she said, I decided I wanted to be in a situation where I could be alone when I wanted to be alone and not alone when I didn't.
Yeah.
And that's the beauty of living in community, is you have that ability to turn the spigot on and off in terms of socialization.
Well, it sounds like the residents at Westminster-Canterbury are living their golden years. So tell us more about the community.
Well, we really strive to be, and I think we are, resort style beachfront senior living. So we have a rack of kayaks that people take out. We have wood shop. We have all kinds of things on the calendar that residents are doing. They're teaching courses to each other. Some people are dining together and meeting new people all the time. So about 700 older adults who are mixing with each other in a situation where, housekeeping is provided. There's a medical clinic on campus. We have transportation programs. If you don't want to have a second car, you don't need a second car. We have, sedans to take you places, all sorts of things. But there is so much to do volunteering off campus or clubs and activities on campus that you're not sitting around bored marking time. So taking a resort-like environment in a resort town and add plenty of opportunities for purpose and engagement, and you get happy people.
Sure. It's the people who are over traveling to resorts and decided, now I want to live on one.
Yeah. I mean, we have residents who call it the land-docked cruise ship, and if you're up in high rise, and you're sitting in your chair, you don't even see the beach because the windowsill would block the beach. It looks like you're on a cruise ship, literally. When you look out over the ocean, you don't see the shore on the other side. Sure. You have everything but the swaying.
Which no one really enjoys anyway.
Yeah, no one wants the motion sickness anyway.
It really is a campus. So you have restaurants, you have shops, right? You have really everything you would need on campus, which is not typical that you'd find in senior living communities. Is that correct?
Yeah, we have our own bank here. We have a hair salon here. We have our own 7-Eleven, kind of light grocery. So we have all the basic human needs can be met on the campus, which is about 18 acres right at the mouth of the Chesapeake Bay in the Atlantic Ocean, as I say, with sand in the front yard. Beach goes right up to the edge of the beach. And it's a small town, basically, with all the services and amenities here on campus. And then, as I say, 80% of people are here for the sort of resort style beachfront senior living lifestyle. And then there are also the planners. 10% need assisted living, are here long enough that they need that, and 10% more nursing, but they graduate into that. They all come healthy.
Sure. So most of your residents are independent living, acty, healthy, maybe 20% need nursing care and assisted living.
Yeah, nursing care or assisted living in that 20%. Sure. But 8 out of 10 are active independent adults who are just here for the lifestyle and here for the community and the lock and leave convenience when they want to go out to dinner or want to go somewhere else.
And how big of a team does it take to operate this community?
Yeah, we have about 300 full-time equivalent workers. Some are part-time, but if you add them all up and divide it by 40 for a normal work week, about 300 here on the core campus. We also have some side businesses. We run a national home health and hospice management and billing company that we started here, and we serve 20 other senior living organizations in starting or running their own home health agencies and hospice agencies based out of their locations.
Sure. So you're offering management services to some other communities or agencies.
Yeah, we are. Some retirement communities don't know how to run home health and hospice. So we had to import people who are good at that and share that talent and spread it out with other retirement communities to make it efficient, to have that limited high-end talent in that area, serve not just Westminster-Canterbury here at the beach, but serve others across the country.
So let's talk a little bit about how the pandemic impacted the community and steps your team had to take to keep everyone safe, but also keep them sane.
We came up with a system that said, if you want to leave, you can leave. And when you come back, you have to be in your apartment for 2 weeks to have the, test and make sure you didn't get the virus. And then you can, as long as you are staying on campus, you can exercise together, you can dine together. And that worked. And we had no infections for a good long time. I think 10, 11 months into the pandemic, zero.
With 700 plus guests, you said?
With 700 plus residents.
Wow.
And so the price of socializing on campus was not to go off of it. And we had great success with that program. It was sustainable. You could go off campus for a family wedding or something like that, and then do your 2 weeks quarantine when you came back. And it gave people choice. It was 2 tracks, and that was really, really successful. We kept in-person dining open. And on the volunteering purpose point, we set up a program, Birdsong Tutor, through our tablet, where former teachers, people who were on campus, could serve and have purpose, helping mothers and fathers and students who were learning from home and overwhelmed by those demands, where they could do some virtual tutoring for kids during the pandemic.
Wow. So your residents, maybe some who had an education background, were able to pick up voluntary tutoring opportunities with other kids in the community through the Birdsong app that you've provided for your residents to access and use.
Yeah, and we've sold that app. We gave it away for a long while, a web version of it. Yeah. But the Birdsong tablet itself, we have 30 other organizations using that. In a rural part of Western Virginia during the pandemic, they were all isolated in their houses, and they had been used to going to senior centers and all the rest. And they were able to have a virtual senior center through our Birdsong tablets and our Birdsong app. And so it's impacting lives, around the country. And that was a cool contribution to make. And that is a charity project of ours, to create that simple tablet with simple software.
Yeah, that, leading into one of my other questions was talking about how you're using innovative technologies to provide better care for your residents. So let's talk a little bit more about the Birdsong tablet and application. So it is hardware and software.
Yeah, well, you could just have the software through a web app if you want. Yeah. But the idea is 6 big buttons, always a home button at the bottom, no matter what you're doing on the tablet, whether you're watching a Netflix movie or whatever, the ability to push the red home button and go right back to the beginning so that you can't break it and you can't get lost. And big buttons that are easy to push that lead you to the content. There's watch for video content. There's listen for music and audio books and all that. There's play for games. And then there's explore for our lifelong learning courses. And then you can go right out to the internet if you want. So it doesn't treat you like a baby, but it's a simplified interface for those who need a simplified interface. And again, then you can go right out to the internet if you want to do that. And
so the software or the tablet has traditional uses as a normal tablet would, with being able to download and install apps that you might find on an app store, but the UI UX has been modified to be very easy to use for the senior population.
Amen. That's the thing. It's got to be easy to use on their own. It has to. And I've heard some of the seniors, particularly in the rural parts of the country, describe it as, well, I never knew how to use a cell phone, but it's kind of like a big cell phone, but better, because even the cell phone is too complicated. And so it gets them past that fear and that embarrassment of needing help to operate a touchscreen like that.
And then you also have your own original content that can be accessed through the app to provide education and entertainment.
Yeah, we have all of our lifelong learning lectures, which again are from Virginia Wesleyan University. That's a private university close by. Their full professors come and they teach adult-sized classes. Maybe some topic will deserve 3 lectures, some other topic 9 lectures, but it's not, gee, I have to do homework and take a test. It's more like adult edutainment learning.
Sure. And this app and tablet is something that you created because you saw so many of your residents struggling with a device that
Yeah, well, we used something similar that was already in the market, but was too expensive. So I said, well, then we're going to have to go design it. So we hired software developers and we made our own. And we've been selling it. I didn't intend to become a software company or a hardware company. We got dragged into it because there was a need that no one else was really addressing in a cost-effective way. And now I'm glad we're in it. We're changing a lot of lives, and we're blessed in a lot of ways during the pandemic by having easy video calls between children and residents, and that was duplicated in at least 30 other organizations and counting so far.
Well, it sounds like you guys are blazing your own trail and really setting the bar high in the industry when it comes to quality of care, experience of residents, and just the overall atmosphere at the community that you've created. It sounds like many other communities are looking at you guys and saying, this is who we want to be.
I mean, there is plenty of need to go around. We can't satisfy it all. So there is no reason to be selfish in this industry. Be an open book, help everybody, be humble enough to learn from others where we aren't good enough yet, where we're still struggling.
Well, Ben, it's been a real pleasure chatting with you today. We've learned a lot about the amazing things your community is doing and some of the technologies you've developed to better serve your residents and other communities who see the value. Again, thank you for your time today. I certainly would like to follow up with you in a few months or next year sometime to learn all the new innovative things that are being rolled out at your community.
Sounds good. I'm sure we'll have a story or two. If you stop inventing and stop growing, you start slipping backwards.
Yeah.
So always try to have some new ideas. We'll see what's up next year.
It seems like your team has been uber creative so far with keeping morales high and doing the best you possibly can when life's obstacles are thrown at you. So, I'm confident that in a few months from now or whenever we connect again, you'll have some very groundbreaking, innovative, recreational or even clinical services that you're providing to the residents. So I'm excited to follow up with you in the future.
Well, great. I'll look forward to the next time we have an opportunity to talk. And Lord willing, we'll keep on having new ideas.
Thank you so much, Ben. You have a wonderful day.
All right. Thanks. Bye.
Thanks again.